My cancer journey dates back to 2015 when I was doing my routine breast examination. I had that habit because I was always scared of cancer. So I could palpate my breasts almost monthly to check if there's any lumps there. So that particular time I felt a breast lump. I visited a doctor in the Aga Khan Hospital who sent me to do mammography. And the report was not showing any signs of cancer, so he requested I repeat after 6 months. During that time, I had read some books that were saying that sugar is bad. It can predispose you to cancer, and I used to take a lot of sugar. So I reduced my sugar intake to 2 spoons. So the years continued. I didn't go back for the checkup again, the repeat, up to year 2017. In my routine check, I realized that the axilla, armpit, there was like a node. When I was doing my breast, there was something I could press on the breast, a lump, and then pain goes to the axilla. At that time, I was shocked. But over those 2 years, I had also gone back to my sugar in the year 2017. I used to take quite a lot. So I realized that change. And in my mind, I felt this must be something different. It might be a cancer now. So I went to Dr. Wasike. Of course, he was not happy. I went disappearing for 2 years, and yet I was to do a repeat. He sent me to do breast ultrasound and mammograph. So I did that. It was during the breast cancer month, November 2017. Then he got the reports. It was showing signs of cancer. Immediately requested for a test called fine needle aspirate to take a sample from that breast lump and take it for histology. So that was done, and it confirmed actually there was cancer in the left breast. So he scheduled me for a mastectomy, which is a removal of the whole breast, left side. And we did that around, I think around 5th of December 2017. So we did that breast surgery. I went through recovery. Around February 2018, I started chemotherapy, still in the Aga Khan Hospital. When we did a PET scan now, that's after 5 years, around August 2023, it showed that there were some parts of some nodes, some nodes in the chest, which didn't dissolve with chemotherapy. So the doctor requested I do a radiotherapy then, 2023. It was 25 sessions. On Monday to Friday, every day. You come, you get your radiotherapy for 30 to 40 minutes. You come following day consistently for 5 weeks. So after I finished around September, October there, I started hormonal therapy, an injection and some tablets, which I have been on since then to date. In January, I did a PET scan to check the progress of the disease. PET scan showed that there's one spot on my left side of the chest, in the lung, that still has active cancer cells. This one, we had to do it because my tumor markers, which is a blood test, was consistently going up from 20 to 40 to 80, and then in January was 120. So the doctor suggested now we go for a targeted radiotherapy. I was prescribed for 5 days of radiotherapy, which are done alternate days. I started on Wednesday. The second one is today. And then I'll do next week on Monday and Wednesday and then Friday, the last dose. For this particular type of radiotherapy, it is very convenient to me as a patient. I don't need to come here every day consecutively, and it's very few days that I'm going to do it. It's only the first dose I had the day before yesterday. Apparently yesterday I felt weak, but I realized because it's high dose, the effects that were coming in week 4 in the previous treatment that I had, the previous radio of 2023, they came early. But it's not too weak that I can't do anything. It's just a small weakness. Once you eat and you regain your energy, you continue with your business. What I can tell them is, it's actually the best to use compared to what we've been going through and what is available in the rest of the country. Because a patient has to sacrifice 5 to 6 weeks of coming to the hospital. And a patient, if the patient needs accompaniment by a next of kin, it's quite taxing because it means the two of them are out of work. They're out of office to come every day. And this particular one, having few days to come, it's cheaper in terms of travels. And it's economical because you have more time to do your own business.